Hi everybody. So my name's Valerie Ayre. I'm the Public Health Manager for County Council, and I cover the Allerdale area. Just recently we've won a National Community Alcohol Partnership award, and this was around tackling underage drinking and in the area of Maryport. CAP, or as they're known, Community Alcohol Partnerships, are all across the country, and obviously they work in all different guises around alcohol reduction basically. But ours was formed originally as a local focus hub project. So we have a partnership in Allerdale where we have all different partners, including the sort of the police and some health services, some of our schools, our retailers are involved. And we came together as a community alcohol partnership. And the reason we kind of went to tackle the underage drinking was that there was been quite a lot of problems around antisocial behaviour in the area with young people who were, drinking on the streets and causing quite a bit of, bad behaviour in the area. So we decided as a partnership, working together with all the different sort of partners involved, that we'd approach the school to see what we could do to get the school on board to help us really, because we just thought that working with young people, as almost the peers to give the messages out would be the best way to tackle some of the problems, and we would get the information hopefully as to what was happening. So initially we did sort of a survey, and we put a survey out to the years 9, 10 and 11, and we got 225 responses back, which we thought was pretty good really for children, young people to respond. But what that told us was quite shocking really, was that a significant amount of them told us that it was their parents and their carers that were buying them and giving them the alcohol, and these are children that are still at school. So we kind of got our heads together and thought we've got to do something about this and make some inroads. So we decided that we would look at how we could actually reduce the incidence of alcohol sales to begin with, particularly those to young people. And also that would hopefully have a knock-on effect around the antisocial behaviour in the area, but also how we could actually increase young people's awareness of the risks of drinking alcohol, and also try and tackle the parents and the carers, because they obviously, were thinking it was okay to give the children the alcohol, whereas we wanted to get the message across really that wasn't really a great idea. So what happened really was that we, after we'd done the partnership, after we'd done the survey, we said that we would ask the young people if they wanted to get some training and some education around health promotion and health awareness really, and they were absolutely inundated with the amount of young people that wanted to come and do this. So we got some funding and we offered a level 2 public health promotion certificate. So this was delivered by CADAS, by Cumbria Alcohol and Drug Advisory Service, and we had 28 young people go through the level 2 course. And as part of that course, they had to do presentations, they had to make up a promotion themselves, they had to go out and talk to people in the community. And then eventually they've completed their course and got their certificates and been, we've had a little sort of get together and told them how great they were. But not only it wasn't sort of finished there and that's the end of it. What we wanted to do then was move on and say, well, what else can you do to keep, to put your learning now into place? So they are now coming out to a number of our community events that we're doing in community centres, sports centres, and so where we're raising awareness about all things sort of health and well-being, and they're there with us to spread the word. And then in school, they're actually doing sort of stands when there's parents' evening, or they do talks to the assemblies, and they're also working with some of the mental health practitioners in the school so that they can spread the word and of good stuff around health promotion, and try and also feed back into us and feed back into the mental health teams of any concerns and any worries that they have about any of the young people. So they become kind of almost peer mentors and coaches to the other young people, which we think is a really fabulous sort of opportunity for them. And we're learning from them and they're learning from us. So it's certainly been a real sort of co-produced piece of work with young people and with our partners. The main difference, I suppose, is that the feedback that we've had from the school is that the children or young people have really enjoyed doing this work and doing this course. We've seen a reduction in antisocial behaviour and in drinking in the area. We've done work with the retailers. So again, we got some funding to do some free online learning for all of the shops in the area that sell alcohol. Because obviously a lot of the big ones will do all the training themselves, but certainly the smaller shops don't. So we've offered this free online training to all of those smaller shops as well as the big ones to do around, the Challenge 25, and just to have a little bit more understanding about what alcohol does to young people, if they are drinking it. So just to make them think about, please don't sell it, please don't sell it to adults who are then going to give it on to the children. So we're just trying to work with them as well to reduce that opportunity of young people getting alcohol in the area. So nationally, there's some, on the case study that I've put some of the figures where the reductions have been in antisocial behaviour, in drinking, in residents reporting any issues. So that gives you a good idea of how successful as a partnership this is. And, we really can't do it without the young people being involved, but also without all of the partners working together as one, one cooperated sort of group. And what we're doing now is that, because it's been so successful, is that we're going to try and replicate exactly what we've done with these young people in Lakes College in September. That's obviously with a slightly older age group of young people. So it'll be interesting to see how that goes, and what they get out of it as well. So I would certainly encourage everybody to have a CAP in their area, have a community alcohol partnership. It's really good working with the partners and working with the young people, and the support that you get from both the regional and the national CAP teams is really, really great. They're there every step of the way, sort of guiding and giving good, best practice from other areas. So if anybody wants some more information, I'd be happy to give them the contacts and let them know how we've done it in our area. But community alcohol partnership. So come to me if you want any more information. Thank you very much.